We're going to talk about glucose and glucose monitoring. So basically, we check for high blood sugar, low blood sugar. The purpose of this, when we're going to be checking a patient's blood sugar, you always want to make sure, one, you're checking the correct patient, name, date of birth, make sure the order is in place for a blood sugar check. And when you collect the supplies, you want to make sure, one, the machine matches your strip. Because if the machine and the strip are two different components, then the strip will not go in and it will not pop up to show and take a blood sample. So one is to make sure that they match. The second piece is to make sure that you're checking the expiration on the bottles. This expiration says 2020. So make sure that it's appropriate. If it's expired, you're going to get inaccurate readings. You could get a high or you could get a low. Next, you also want to check, you want to make sure you got some alcohol pads, you got some gauze, and your needles. Your Lancets also have an expiration on the box too. This expires in 2023. So making sure that everything, its expiration dates are appropriate, checking the patient to make sure we're checking the order, and then we can check the blood sample. So when you press and turn the machine on, and each machine is going to be a little bit different. Typically the ones at the hospital, you would have to scan the patient's bracelet in, and that would identify the correct patient and that they're in the system. These are kind of at-home glucose monitoring machines. So when you turn it on, it's automatically asking and flashing for you to put the strip in. So you open the bottle, and the strip goes in the little gray magnetic piece. That is going right into the machine. And then that little tip is where the blood is going to go into, okay? So before we check blood, we want to make sure that the strip is all the way in. Now the machine is asking for the blood sample to be put on the strip. Now, you always alcohol swab a finger. You want to make sure you're pricking not the middle of the pad, but the outside of the fingers, because the middle tips of your finger pads have a lot of nerve endings and it's going to be more painful. So you can prick the side of the finger. So you want to scrub probably for a good 15 to 20 seconds, just to make sure you're getting all junk off the fingers, you're not getting any bacteria onto that needle. You're going to unclip this. This is the little needle. And then you're going to take your gauze and you're going to wipe the alcohol off. Only because the alcohol can alter the blood sample. You could get a high or a low reading, so you want to make sure it's accurate. You're going to put pressure down on the finger. Make sure if you're doing this to somebody, you have gloves on for personal protective purposes. You're going to squeeze, and then you're going to simply just prick. And you're going to squeeze, squeeze, squeeze. My fingers are cold because the AC is on. Squeeze. And the first bleb, we're going to wipe off. We have a nice blood bleb there. And you're just going to simply put it to the machine, and it's going to suck it right in. Upside down. And my blood sugar is 99. Okay? And that is how you check a sample. Before you throw all the equipment away, make sure anything that has blood on it or the needle goes in the appropriate bins. Will go in the biohazard. Blood and body soil. Needles go into the needle bin. And that is how you check blood glucose.